Question 1. A medical surgical nurse receives bedside report on 4 clients at 0700. Due to staffing shortages, the nurse will care for all 4 clients until additional staff arrive. Which client should the nurse assess first? A 72-year-old client with chronic heart failure who reports gaining 2 pounds overnight and has bilateral ankle edema rated 2+. B. A 58-year-old client who underwent a thyroidectomy 8 hours ago and is now reporting increasing neck tightness, difficulty swallowing, and a muffled voice. C. A 44-year-old client with type 2 diabetes mellitus whose morning blood glucose is 315 mg per deciliter and who reports increased thirst. D. A 66-year-old client receiving 4 ceftriaxone who reports mild nausea and has vomited once during the night. Answer: B. A 58-year-old client who underwent a thyroidectomy 8 hours ago and is now reporting increasing neck tightness, difficulty swallowing, and a muffled voice. Rationale: this client is demonstrating signs of a developing airway obstruction secondary to postoperative hemorrhage or edema. Difficulty swallowing, neck tightness, and voice changes after thyroid surgery are classic warning signs of airway compromise. Airway problems always take priority over circulation, comfort, or metabolic issues. Option A indicates fluid retention but is not immediately life-threatening. Option C has hyperglycemia, which requires intervention but does not supersede an airway emergency. Option D reflects a non-life-threatening adverse effect. Nclex strategy. Ask, who can die first if I leave the room? Airway compromise beats breathing problems, circulation problems, pain, nausea, laboratory abnormalities, and chronic condition exacerbations. Question 2. A nurse in the emergency department receives reports on 4 newly arrived clients. Which client should the nurse see first? A 24-year-old with a fractured wrist reporting pain of 9/10. B. A 67-year-old with sudden onset slurred speech and facial drooping that began 30 minutes ago. C. A 31-year-old with fever of 101.5 degrees Fahrenheit 38.6 degrees Celsius and sore throat. D. A 54-year-old with a history of renal calculi reporting flank pain and nausea. Answer: B. A 67-year-old with sudden onset slurred speech and facial drooping that began 30 minutes ago. Rationale: the client is exhibiting signs of an acute ischemic stroke. The onset occurred 30 minutes ago, placing the client within the potential thrombolytic treatment window. Rapid assessment and intervention can preserve brain tissue. Pain, fever, and kidney stone symptoms are important but do not represent a time-sensitive neurologic emergency. Nclex strategy. The Nclex loves asking, who has the most to gain from immediate treatment? Stroke, STEMI, sepsis, and airway emergencies are often prioritized because delays create irreversible damage. Question 3. A nurse is caring for 4 clients. Which client should the nurse assess first? A client receiving a blood transfusion who reports low back pain and chills 10 minutes after initiation. B. A client with pneumonia whose oxygen saturation is 92% on 2L nasal cannula. C. A client with pancreatitis reporting abdominal pain of 8/10. D. A client scheduled for discharge who is waiting for instructions. Answer: A client receiving a blood transfusion who reports low back pain and chills 10 minutes after initiation. Rationale: low back pain and chills shortly after beginning a transfusion strongly suggest an acute hemolytic transfusion reaction. This reaction can rapidly progress to shock, disseminated intravascular coagulation, kidney failure, and death. The transfusion must be stopped immediately. The pneumonia client is stable. Pain management can wait until the emergency is addressed. Discharge teaching is lowest priority. Nclex strategy. When transfusion reactions appear in an answer choice, consider them a high-priority emergency unless another client has an airway issue. Question 4. A nurse on a telemetry unit receives the following reports. Which client requires immediate assessment? A client with atrial fibrillation whose heart rate increased from 82 to 110 beats/min. B. A client with heart failure who has crackles in both lung bases. C. A client with chest pain whose telemetry monitor suddenly shows ventricular tachycardia and who is unresponsive. D. A client with hypertension whose blood pressure is 168/92 mmHg. Answer: C. A client with chest pain whose telemetry monitor suddenly shows ventricular tachycardia and who is unresponsive. Rationale: unresponsiveness plus ventricular tachycardia indicates a life-threatening cardiac arrest situation requiring immediate intervention. The other clients are stable despite abnormal findings. Nclex strategy. ABCs plus responsiveness. An unresponsive client almost always jumps to the top of the priority list. Question 5. A nurse is caring for 4 postoperative clients. Which client should be assessed first? A. A client 12 hours after abdominal surgery with absent bowel sounds. B. A client 24 hours after surgery requesting pain medication. C. A client 2 hours after surgery whose respiratory rate is 8 per minute after receiving 4 morphine. D. A client 18 hours after surgery with temperature of 100.4 degrees Fahrenheit 38 degrees Celsius. Answer: C. A client 2 hours after surgery whose respiratory rate is 8 per minute after receiving 4 morphine. Rationale: respiratory depression is a potentially fatal opioid complication. A respiratory rate of 8 per minute indicates hypoventilation and possible progression to respiratory arrest. The other findings are expected postoperative findings. Nclex strategy. Any answer involving respiratory rate less than 10, airway obstruction, oxygen saturation collapse. Usually outranks pain, fever, or gastrointestinal concerns. Question 6. A charge nurse is assigning clients to an LPN. Which client is appropriate to assign? A. Newly admitted client with diabetic ketoacidosis. B. Client requiring initial postoperative assessment. C. Stable client receiving routine dressing changes for a stage 2 pressure injury. D. Client with chest pain awaiting diagnostic testing. Answer: C. Stable client receiving routine dressing changes for a stage 2 pressure injury. Rationale: LPNs can care for stable clients with predictable outcomes. DKA, postoperative assessments, and chest pain require RN assessment and clinical judgment. Nclex strategy. LPN equals stable, predictable, routine. RN equals unstable, new admission, teaching, assessment. Question 7. A nurse is caring for 4 clients. Which client should the nurse assess first? A. A client with COPD whose oxygen saturation decreased from 95% to 88%. B. A client with a fractured femur reporting pain 10/10. C. A client with gastroenteritis who had 1 episode of diarrhea. D. A client requesting assistance to the bathroom. Answer: A. A client with COPD whose oxygen saturation decreased from 95% to 88%. Rationale: the client is demonstrating worsening oxygenation. Breathing takes priority over pain and routine needs. Nclex strategy. Remember: breathing before bleeding. Breathing before pain. Breathing before mobility. Question 8. A nurse notes the following clients. Which client requires immediate intervention? A. Potassium level 6.8 milliequivalent/L. B. Sodium level 132 milliequivalent/L. C. Hemoglobin 11g/dl. D. Calcium level 8.6 milligrams per deciliter. Answer: A. Potassium level 6.8 milliequivalent/L. Rationale: severe hyperkalemia can cause fatal cardiac dysrhythmias and cardiac arrest. The remaining laboratory values are relatively mild abnormalities. Nclex strategy. Memorize deadly lab values. Potassium greater than 6.0. Glucose less than 70. Magnesium 4. INR critically elevated. Severe hypoxemia. These frequently appear in priority questions. Question 9. A nurse receives report on 4 pediatric clients. Which child should be assessed first? A. Child with asthma who is restless and has diminished breath sounds. B. Child with otitis media crying because of ear pain. C. Child with gastroenteritis requesting juice. D. Child with a cast reporting itching. Answer: A. Child with asthma who is restless and has diminished breath sounds. Rationale: restlessness is an early sign of hypoxia. Diminished breath sounds may indicate severe airway obstruction and impending respiratory failure. Nclex strategy. Nclex trap. Many students choose wheezing. The more dangerous sign is often silent or diminished breath sounds, indicating very little air movement. Question 10. A nurse is caring for 4 clients. Which client should the nurse see first? A. Client with bacterial meningitis reporting worsening headache. B. Client with acute epiglottitis who is drooling and sitting upright. C. Client with influenza requesting acetaminophen. D. Client with sinusitis reporting congestion. Answer: B. Client with acute epiglottitis who is drooling and sitting upright. Rationale: drooling and tripod positioning indicate severe airway obstruction. Airway compromise takes priority over neurologic discomfort or routine symptoms. Nclex strategy. Whenever you see drooling, stridor, tripod position, inability to swallow, think airway first. Question 11. A nurse is caring for 4 clients in a progressive care unit. Which client should the nurse assess first? A client with pancreatitis whose calcium level is 7.9 mg per deciliter and reports tingling around the mouth. B. A client with cirrhosis who reports mild nausea after breakfast. C. A client with chronic kidney disease whose blood pressure is 150/88 mmHg. D. A client with ulcerative colitis who had 2 loose stools overnight. Answer: A client with pancreatitis whose calcium level is 7.9 mg per deciliter and reports tingling around the mouth. Rationale: perioral tingling suggests symptomatic hypocalcemia, which can progress to tetany, laryngospasm, seizures, and cardiac dysrhythmias. The client's condition can rapidly become life-threatening. The remaining clients have expected or less urgent findings. Nclex strategy. Priority questions frequently hide emergencies within assessment findings. Symptoms indicating neurologic or cardiac instability often outrank abnormal vital signs that are only mildly elevated. Question 12. A nurse enters a client's room and finds the client suddenly short of breath. Which assessment finding requires immediate intervention? A. Oxygen saturation 90%. B. Respiratory rate 28 per minute. C. Trachea deviated away from the affected side after chest trauma. D. Heart rate 108 per minute. Answer: C. Trachea deviated away from the affected side after chest trauma. Rationale: tracheal deviation after trauma suggests tension pneumothorax, a life-threatening emergency that can rapidly lead to cardiovascular collapse. The other findings are concerning but expected manifestations of respiratory distress. Nclex strategy. Tension pneumothorax is one of Nclex's favorite must recognize immediately emergencies. Think tracheal deviation, absent breath sounds, severe dyspnea, distended neck veins. Equals immediate intervention. Question 13. A nurse is caring for 4 clients. Which client should be seen first? A client with syndrome of inappropriate antidiuretic hormone, SIAD, whose sodium level is 118 milliequivalent/L. B. A client with chronic obstructive pulmonary disease reporting fatigue. C. A client with rheumatoid arthritis requesting pain medication. D. A client with gastroesophageal reflux disease requesting breakfast. Answer: A client with SIAD whose sodium level is 118 milliequivalent/L. Rationale: severe hyponatremia can result in cerebral edema, seizures, coma, and death. The remaining clients are stable. Nclex strategy. Extremely abnormal laboratory values often represent hidden priority emergencies. Sodium below 120 milliequivalent/L should immediately raise concern for neurologic deterioration. Question 14. A nurse receives report on 4 laboring clients. Which client should be assessed first? A. A client whose fetal heart rate is 170 per minute for 15 minutes. B. A client requesting an epidural. C. A client reporting back discomfort. D. A client whose cervical dilation increased from 5 centimeters to 6 centimeters. Answer: A. A client whose fetal heart rate is 170 per minute for 15 minutes. Rationale: persistent fetal tachycardia may indicate fetal hypoxia, maternal infection, or fetal distress. The nurse should assess both maternal and fetal status immediately. Nclex strategy: in maternity priority questions, remember: fetal oxygenation takes precedence over maternal comfort. Question 15. A nurse is caring for 4 clients on a medical unit. Which client should be assessed first? A. Client with a nasogastric tube draining green fluid. B. Client with pneumonia whose oxygen saturation dropped from 95% to 86%. C. Client requesting antiemetics. D. Client with constipation who has not had a bowel movement for 2 days. Answer: B. Client with pneumonia whose oxygen saturation dropped from 95% to 86%. Rationale: the significant decrease in oxygen saturation indicates worsening respiratory compromise and possible respiratory failure. Nclex strategy: trend changes are extremely important. A client worsening from baseline often has priority over a client who is stable but abnormal. Question 16. A charge nurse is making assignments. Which client is most appropriate for an experienced float nurse from the postpartum unit? A. Stable client 1 day after appendectomy. B. Client with active gastrointestinal bleeding. C. Client requiring titration of vasoactive medications. D. Client admitted with septic shock. Answer: A. Stable client 1 day after appendectomy. Rationale: float nurses should receive stable clients whose care is predictable. Unstable clients require specialized experience and unit familiarity. Nclex strategy: when assigning staff, stable equals float nurse. Unstable equals core staff. Question 17. A nurse assesses 4 clients. Which finding requires immediate follow-up? A. New onset confusion in an 82-year-old client with urinary tract infection. B. Temperature 99.8 degrees Fahrenheit 37.7 degrees Celsius. C. Pain score 6 out of 10. D. Blood pressure 142/84 mmHg. Answer: A. New onset confusion in an 82-year-old client with urinary tract infection. Rationale: acute mental status changes may indicate sepsis, hypoxia, metabolic abnormalities, or neurologic compromise. Sudden confusion is never considered a normal aging change. Nclex strategy: acute changes always beat chronic conditions. New confusion equals priority until proven otherwise. Question 18. A nurse is caring for 4 postoperative clients. Which client should be assessed first? A. Client 12 hours after hip surgery reporting calf pain and swelling. B. Client requesting repositioning. C. Client reporting incisional discomfort. D. Client with dry lips requesting water. Answer: A. Client 12 hours after hip surgery reporting calf pain and swelling. Rationale: calf pain and swelling suggest deep vein thrombosis. A clot may embolize to the lungs and become fatal. Nclex strategy: think beyond what is happening now. Nclex often prioritizes the client at highest risk for imminent deterioration. Question 19. A nurse is caring for 4 clients. Which client requires immediate assessment? A. Client with acute myocardial infarction who suddenly develops crackles and severe dyspnea. B. Client requesting discharge instructions. C. Client with osteoarthritis reporting pain. D. Client awaiting transport. Answer: A. Client with acute myocardial infarction who suddenly develops crackles and severe dyspnea. Rationale. These findings suggest acute left-sided heart failure and pulmonary edema. Respiratory compromise is occurring. Nclex strategy. Any sudden deterioration after MI should immediately raise concern for a life-threatening complication. Question 20. A nurse receives shift report. Which client should be seen first? A. Client with sickle cell crisis reporting severe pain. B. Client with bacterial meningitis whose blood pressure dropped from 118/76 to 88/54 mm Hg. C. Client requesting assistance with hygiene. D. Client awaiting lunch tray. Answer. B. Client with bacterial meningitis whose blood pressure dropped from 118/76 to 88/54 mm Hg. Rationale. This sudden hypotension may indicate septic shock. Shock threatens perfusion of vital organs and requires immediate intervention. Nclex strategy. Shock beats pain. Always prioritize perfusion emergencies over comfort needs. Question 21. A nurse on a step-down cardiac unit receives bedside report on 4 clients. Due to a rapid response occurring elsewhere on the unit, the nurse knows assistance may be delayed. Which client should the nurse assess first? A. A client admitted with heart failure whose urine output decreased from 40 ml per hour to 25 ml per hour over the last 3 hours. B. A client who experienced an anterior wall myocardial infarction yesterday and now reports sudden shortness of breath, anxiety, pink frothy sputum, and oxygen saturation of 84%. C. A client receiving furosemide whose potassium level is 3.2 milliequivalent/L. D. A client scheduled for discharge who reports mild dizziness upon standing. Answer. B. A client who experienced an anterior wall myocardial infarction yesterday and now reports sudden shortness of breath, anxiety, pink frothy sputum, and oxygen saturation of 84%. Rationale. This client is exhibiting classic signs of acute pulmonary edema. Findings include pink frothy sputum, severe hypoxemia, dyspnea, anxiety. Acute pulmonary edema can rapidly progress to respiratory failure and death. Option A demonstrates worsening renal perfusion but not immediate respiratory collapse. Option C requires intervention but is stable. Option D is least urgent. Nclex strategy. The Nclex frequently disguises airway emergencies as cardiac problems. Whenever you see pink frothy sputum, severe dyspnea, low oxygen saturation, think airway and breathing first. Question 22. The nurse is assigned 4 clients. Which client should be assessed first? A. A client admitted for alcohol withdrawal who is becoming increasingly restless and reports seeing insects crawling on the ceiling. B. A client with chronic pancreatitis requesting additional pain medication. C. A client with hypertension whose blood pressure is 170/94 mmHg. D. A client recovering from appendectomy with temperature of 100.2 degrees Fahrenheit 37.9 degrees Celsius. Answer. A. A client admitted for alcohol withdrawal who is becoming increasingly restless and reports seeing insects crawling on the ceiling. Rationale. The client is progressing toward delirium tremens, DTs. Delirium tremens can cause severe autonomic instability, seizures, cardiac dysrhythmias, death. Hallucinations and increasing agitation indicate rapidly worsening withdrawal. Nclex strategy. Ask. Which client could become critically unstable within the next hour? That client usually receives priority. Question 23. A nurse receives report on 4 clients. Which client should be assessed first? A. A client with a chest tube whose drainage increased from 30 ml per hour to 35 ml per hour. B. A client with chronic kidney disease whose potassium level is 7.0 milliequivalent/L and whose telemetry monitor shows peaked T waves. C. A client with pneumonia whose temperature is 101.4 degrees Fahrenheit 38.6 degrees Celsius. D. A client with Crohn's disease reporting diarrhea. Answer: B. A client with chronic kidney disease whose potassium level is 7.0 milliequivalent/L and whose telemetry monitor shows peaked T waves. Rationale: hyperkalemia with ECG changes is a life-threatening emergency. The client is at immediate risk for ventricular fibrillation, asystole, sudden cardiac arrest. This client requires immediate intervention. Nclex strategy: abnormal lab plus symptoms equals higher priority than abnormal lab alone. Question 24. A nurse is caring for 4 postoperative clients. Which client should the nurse see first? A. A client 24 hours after bowel surgery whose abdomen is slightly distended. B. A client 8 hours after carotid endarterectomy whose neck dressing is becoming increasingly swollen and tight. C. A client requesting pain medication. D. A client with nausea after receiving antibiotics. Answer: B. A client 8 hours after carotid endarterectomy whose neck dressing is becoming increasingly swollen and tight. Rationale: neck swelling following carotid surgery may indicate hemorrhage. The expanding hematoma can rapidly obstruct the airway. Airway compromise is imminent. Nclex strategy: Nclex favorite rule. Swelling around the neck equals airway emergency until proven otherwise. Question 25. A charge nurse is assigning tasks to a newly licensed RN and an experienced LPN. Which task should the charge nurse assign to the LPN? A. Initial assessment of a newly admitted client with sepsis. B. Teaching a client newly diagnosed with diabetes. C. Monitoring a stable client receiving enteral feedings. D. Evaluating effectiveness of a blood transfusion. Answer: C. Monitoring a stable client receiving enteral feedings. Rationale: stable clients with predictable outcomes are appropriate for LPN assignment. The RN must perform initial assessments, teaching, evaluation. Nclex strategy: LPN equals stable, routine, predictable. RN equals assess, teach, evaluate. Question 26. A nurse is caring for 4 clients. Which client requires immediate assessment? A. A client with acute pancreatitis who suddenly develops left flank ecchymosis. B. A client with osteoarthritis requesting assistance to the bathroom. C. A client with gastritis reporting nausea. D. A client with constipation requesting a stool softener. Answer: A. A client with acute pancreatitis who suddenly develops left flank ecchymosis. Rationale: Gray-Turner's sign indicates retroperitoneal hemorrhage. This suggests severe hemorrhagic pancreatitis. The client is at risk for shock, organ failure, death. Nclex strategy: unexpected bleeding signs are almost always high priority. Question 27. A nurse is caring for 4 clients. Which client should be assessed first? A. A client with diabetic ketoacidosis whose blood glucose decreased from 720 mg per deciliter to 260 mg per deciliter within 2 hours and who now reports headache and confusion. B. A client with hyperthyroidism reporting tremors. C. A client with rheumatoid arthritis requesting pain medication. D. A client with chronic kidney disease requesting lunch. Answer: A. A client with diabetic ketoacidosis whose blood glucose decreased from 720 mg per deciliter to 260 mg per deciliter within 2 hours and who now reports headache and confusion. Rationale: rapid glucose reduction can lead to cerebral edema. New neurologic symptoms suggest a life-threatening complication. Confusion is never expected during successful DKA treatment. Nclex strategy: a changing neurological status is always a priority finding. Question 28. A nurse receives report on 4 clients. Which client should the nurse assess first? A. A client with asthma whose wheezing has suddenly disappeared and who appears exhausted. B. A client with bronchitis reporting productive cough. C. A client requesting a breathing treatment. D. A client with allergic rhinitis reporting congestion. Answer: A. A client with asthma whose wheezing has suddenly disappeared and who appears exhausted. Rationale: this is one of Nclex's most dangerous traps. Many students think less wheezing means improvement. Actually, absent wheezing in severe asthma may indicate almost no air movement. The client may be entering respiratory failure. Nclex strategy: when an asthmatic suddenly stops wheezing and becomes fatigued, think silent chest equals impending arrest. Question 29. A nurse receives report on 4 clients. Which client requires immediate intervention? A. A client receiving total parenteral nutrition whose blood glucose is 245 mg per deciliter. B. A client with cirrhosis who develops new hysterexis and confusion. C. A client with chronic obstructive pulmonary disease whose oxygen saturation is 90%. D. A client with heart failure reporting mild fatigue. Answer: B. A client with cirrhosis who develops new hysterexis and confusion. Rationale: hysterexis plus confusion strongly suggest hepatic encephalopathy. The client is at risk for progressive neurologic deterioration, coma, airway compromise. Nclex strategy: any sudden mental status change should immediately move a client higher on the priority list. Question 30. A nurse receives report on 4 clients during shift change. Which client should be assessed first? A. A client with septic shock whose blood pressure has fallen from 98/60 mm/Hg to 78/42 mm/Hg despite fluid resuscitation. B. A client with cellulitis reporting pain 8/10. C. A client requesting discharge instructions. D. A client with chronic heart failure reporting fatigue. Answer: A. A client with septic shock whose blood pressure has fallen from 98/60 mmHg to 78/42 mmHg despite fluid resuscitation. Rationale: this client is experiencing worsening shock despite treatment. Signs include severe hypotension, failure to respond to fluids, potential progression to multi-organ failure. The client is at immediate risk for death. Nclex strategy: when 2 clients seem unstable, ask, who is actively dying right now? The answer is usually the priority. Question 31. A nurse working on a medical intensive care unit receives report on 4 clients at 0700. Due to a mass casualty event in the community, additional admissions are expected within the hour. Which client should the nurse assess first? A. A 70-year-old client with acute decompensated heart failure whose oxygen saturation decreased from 95% to 90% while receiving 2 liters per minute oxygen via nasal cannula. B. A 64-year-old client admitted for septic shock whose urine output has decreased from 45 milliliters per hour to 15 milliliters per hour over the last 2 hours. C. A 58-year-old client who was extubated 30 minutes ago and is now becoming increasingly restless, unable to speak in complete sentences, and demonstrating inspiratory stridor. D. A 39-year-old client with diabetic ketoacidosis whose blood glucose is 285 mg per deciliter and potassium level is 3.1 milliequivalent/L. Answer: C. A 58-year-old client who was extubated 30 minutes ago and is now becoming increasingly restless, unable to speak in complete sentences, and demonstrating inspiratory stridor. Rationale: this client is demonstrating upper airway obstruction after extubation. Key clues: inspiratory stridor, restlessness, inability to speak normally. The airway may completely close within minutes. Option B is severe but represents worsening perfusion rather than immediate airway loss. Option A has oxygenation concerns but remains ventilating. Option D is unstable but not an immediate airway failure. Nclex strategy: when faced with several unstable clients, actual airway obstruction beats potential circulatory collapse. Question 32. A nurse receives report on 4 postoperative clients. Which client should the nurse assess first? A. A client 24 hours after total hip replacement who reports calf tenderness and mild swelling. B. A client 12 hours after bowel resection whose abdomen is firm, distended, and increasingly painful. C. A client 6 hours after thyroidectomy who suddenly states, "I feel like something is choking me." D. A client 8 hours after hysterectomy with urine output of 28 milliliters per hour. Answer: C. A client 6 hours after thyroidectomy who suddenly states, "I feel like something is choking me." Rationale: the statement suggests airway compression from hemorrhage or edema. Nclex frequently hides airway emergencies within patient statements rather than objective findings. The nurse should immediately inspect the neck and airway. Nclex strategy: pay attention to what the patient says. Statements like, "I can't breathe," "Something is choking me," "My throat feels tight," often indicate airway emergencies. Question 33. A nurse is caring for 4 clients. Which client should be assessed first? A. A client receiving heparin whose activated partial thromboplastin time, APTT, is 110 seconds. B. A client with syndrome of inappropriate antidiuretic hormone whose sodium level decreased from 125 milliequivalent/L to 118 milliequivalent/L and who is now confused. C. A client with heart failure whose weight increased by 2 pounds overnight. D. A client with chronic kidney disease whose blood pressure is 168/94 mmHg. Answer: B. A client with syndrome of inappropriate antidiuretic hormone whose sodium level decreased from 125 milliequivalent/L to 118 milliequivalent/L and who is now confused. Rationale: severe hyponatremia plus neurologic changes suggests cerebral edema. The client is at risk for seizures, coma, brain herniation. Although the elevated APTT is concerning, the client with neurologic deterioration is the priority. Nclex strategy: abnormal laboratory value plus symptoms, abnormal laboratory value alone. Question 34. A charge nurse is assigning clients to staff members. Which assignment should the charge nurse question? A. Experienced RN assigned a client receiving vasopressors. B. LPN assigned a stable client receiving tube feedings. C. Newly licensed RN assigned a client 24 hours after appendectomy. D. UAP assigned a client experiencing chest pain while awaiting diagnostic testing. Answer: D. UAP assigned a client experiencing chest pain while awaiting diagnostic testing. Rationale: chest pain requires assessment and continuous clinical judgment. A UAP cannot assess, evaluate, or monitor an unstable client. Nclex strategy: unstable clients never belong to the UAP. Remember, assessing, teaching, evaluating equals RN only. Question 35. A nurse receives report on 4 emergency department clients. Which client should the nurse assess first? A. A client with suspected stroke whose symptoms began 20 minutes ago. B. A client with a femur fracture reporting pain 10/10. C. A client with pneumonia whose oxygen saturation is 92%. D. A client with fever and productive cough. Answer: A. A client with suspected stroke whose symptoms began 20 minutes ago. Rationale: this question tests time-sensitive treatment priority. The client may qualify for thrombolytic therapy. Every minute of delay increases neuronal death. Nclex strategy: Nclex often prioritizes stroke, STEMI, sepsis, because treatment windows matter. Question 36. A nurse is caring for 4 clients. Which client should the nurse assess first? A. A client with liver failure who develops new confusion and hysterexis. B. A client with ulcerative colitis who reports abdominal cramping. C. A client with chronic pain requesting medication. D. A client with hypertension whose BP is 164/88 mmHg. Answer: A. A client with liver failure who develops new confusion and hysterexis. Rationale: new confusion indicates hepatic encephalopathy. Progression can result in coma, loss of airway protective reflexes, respiratory compromise, Nclex strategy. The Nclex loves neurologic deterioration questions. Mental status changes often indicate impending instability. Question 37. A nurse is caring for 4 clients. Which client requires immediate intervention? A. A client with chest trauma whose trachea is deviated and whose neck veins are distended. B. A client with pneumonia whose respiratory rate is 26 per minute. C. A client with asthma whose oxygen saturation is 93%. D. A client with chronic bronchitis who reports fatigue. Answer: A. A client with chest trauma whose trachea is deviated and whose neck veins are distended. Rationale. These findings indicate tension pneumothorax. Without rapid decompression, venous return falls. Cardiac output collapses. Death may occur rapidly. Nclex strategy. When you see tracheal deviation, distended neck veins, trauma, think tension pneumothorax equals emergency. Question 38. A nurse enters a room and finds a client who suddenly becomes unresponsive. Which action should the nurse take first? A. Obtain vital signs. B. Activate emergency response and assess for pulse. C. Notify the healthcare provider. D. Review laboratory results. Answer: B. Activate emergency response and assess for pulse. Rationale. The nurse must immediately determine whether cardiac arrest is present. The client's survival depends on rapid assessment and initiation of resuscitation. Nclex strategy. For unresponsive clients, check responsiveness. Assess pulse and breathing. Activate emergency response. Everything else comes later. Question 39. A nurse receives report on 4 clients. Which client should the nurse assess first? A. A client with diabetic ketoacidosis whose blood glucose has decreased rapidly and who suddenly develops headache, confusion, and bradycardia. B. A client with hyperthyroidism reporting palpitations. C. A client with chronic pancreatitis reporting abdominal pain. D. A client requesting discharge instructions. Answer: A. A client with diabetic ketoacidosis whose blood glucose has decreased rapidly and who suddenly develops headache, confusion, and bradycardia. Rationale. These findings suggest cerebral edema with increasing intracranial pressure. Bradycardia combined with neurologic deterioration is extremely concerning. The client is at risk for brain herniation. Nclex strategy. A changing neurological status often outranks nearly every other finding. Question 40. A nurse receives report on 4 clients immediately before shift change. Which client requires assessment first? A. A client with septic shock whose mean arterial pressure continues to decline despite vasopressor therapy. B. A client with acute respiratory distress syndrome whose oxygen saturation is 82% despite a non-rebreather mask. C. A client with acute kidney injury whose creatinine increased from 2.1 to 3.0 milligrams per deciliter. D. A client with gastrointestinal bleeding whose hemoglobin decreased from 9.8 g/dl to 8.7 g/dl. Answer: B. A client with acute respiratory distress syndrome whose oxygen saturation is 82% despite a non-rebreather mask. Rationale. This is an extremely difficult Nclex-style question because 2 clients appear to be dying. The ARDS client is failing maximal oxygen therapy. An oxygen saturation of 82% despite a non-rebreather indicates severe refractory hypoxemia and impending respiratory arrest. The septic shock client is also critical, but oxygenation failure generally takes priority over worsening perfusion when immediate respiratory collapse is occurring. Nclex strategy. When 2 clients appear unstable, ask: who is losing oxygen to the brain right now? Airway and oxygenation usually outrank circulation when both are critically compromised. Question 41. A nurse in a critical care unit receives report on 4 clients at the beginning of the shift. Due to severe staffing shortages, the nurse knows assistance may not be immediately available. Which client should the nurse assess first? A client with septic shock receiving norepinephrine whose mean arterial pressure decreased from 70 mm of mercury to 58 mm of mercury during the last 15 minutes. B. A client with acute respiratory distress syndrome receiving mechanical ventilation whose high-pressure alarm is sounding continuously and whose oxygen saturation has fallen from 94% to 78%. C. A client with diabetic ketoacidosis whose potassium level is 2.9 milliequivalent/L during insulin infusion. D. A client with gastrointestinal bleeding whose hemoglobin decreased from 8.4 g/dl to 7.8 g/dl. Answer: B. A client with acute respiratory distress syndrome receiving mechanical ventilation whose high-pressure alarm is sounding continuously and whose oxygen saturation has fallen from 94% to 78%. Rationale. This is a true Nclex nightmare question because every client is unstable. The ventilated client has evidence of immediate oxygenation failure. Possible causes include mucus plug, kinked tubing, pneumothorax, severe airway obstruction. Without correction, cardiac arrest may occur within minutes. Nclex strategy. When every answer looks critical, choose the client who will die first, not the client who is sickest overall. Question 42. A nurse is caring for 4 postoperative clients. Which client should be assessed first? A. A client 6 hours after thyroidectomy who reports neck pressure and is swallowing repeatedly. B. A client 12 hours after bowel surgery whose pain increased from 5 out of 10 to 8/10. C. A client 24 hours after hip surgery with calf tenderness. D. A client 8 hours after hysterectomy with urine output of 25 milliliters per hour. Answer: A. A client 6 hours after thyroidectomy who reports neck pressure and is swallowing repeatedly. Rationale. Repeated swallowing is a classic Nclex clue for postoperative neck hemorrhage. The accumulating blood may compress the trachea. Airway compromise is imminent. Nclex strategy. Nclex rarely gives obvious airway clues. Look for subtle indicators. Frequent swallowing. Voice changes. Neck fullness. Restlessness. Question 43. A nurse receives report on 4 clients. Which client requires immediate intervention? A. A client with acute pancreatitis whose calcium level is 6.8 mg per deciliter and who has positive Chvostek and Trousseau signs. B. A client with chronic kidney disease whose phosphorus level is elevated. C. A client with cirrhosis who reports mild nausea. D. A client with ulcerative colitis who had 3 loose stools. Answer: A. A client with acute pancreatitis whose calcium level is 6.8 mg per deciliter and who has positive Chvostek and Trousseau signs. Rationale. The client has severe symptomatic hypocalcemia. Life-threatening complications include laryngospasm, seizures, ventricular dysrhythmias. The airway may become compromised unexpectedly. Nclex strategy. The Nclex often disguises airway emergencies as electrolyte abnormalities. Question 44. A charge nurse is assigning care for 4 clients. Which assignment is inappropriate? A. UAP obtains vital signs on stable postoperative clients. B. UAP transports a stable client to radiology. C. UAP remains with a confused client at risk for falls. D. UAP monitors a newly initiated blood transfusion. Answer: D. UAP monitors a newly initiated blood transfusion. Rationale. Blood transfusions require ongoing nursing assessment for hemolytic reactions, allergic reactions, circulatory overload. A licensed nurse must perform monitoring. Nclex strategy. If a task involves assessment, evaluation, or judgment, it is not delegated to a UAP. Question 45. A nurse receives report on 4 emergency department clients. Which client should be seen first? A. A client with sudden chest pain whose ECG shows ST segment elevation in leads 2, 3, and AVF. B. A client with asthma whose oxygen saturation is 91%. C. A client with a fractured tibia reporting pain October 10th. D. A client with pneumonia and fever. Answer: A. A client with sudden chest pain whose ECG shows ST segment elevation in leads 2, 3, and AVF. Rationale: this client is experiencing an acute STEMI. Myocardial tissue is actively dying. Rapid reperfusion therapy significantly improves survival. Nclex strategy. STEMI questions often test time-sensitive treatment priority rather than ABCs alone. Question 46. A nurse is caring for 4 clients. Which client requires immediate assessment? A. A client with bacterial meningitis who suddenly develops petechiae, hypotension, and cool extremities. B. A client with osteoarthritis requesting pain medication. C. A client with hypertension whose BP is 162/88 mmHg. D. A client with GERD reporting heartburn. Answer: A. A client with bacterial meningitis who suddenly develops petechiae, hypotension, and cool extremities. Rationale: these findings suggest meningococcemia with septic shock. Rapid progression can cause disseminated intravascular coagulation, multi-organ failure, death. Nclex strategy. Watch for clusters of findings. 3 concerning findings together often indicate the priority client. Question 47. A nurse receives report on 4 clients. Which client should be assessed first? A. A client with COPD whose respiratory rate increased from 20 per minute to 34 per minute and who is becoming drowsy. B. A client with heart failure whose weight increased 3 pounds overnight. C. A client with rheumatoid arthritis reporting pain. D. A client with constipation requesting a laxative. Answer: A. A client with COPD whose respiratory rate increased from 20 per minute to 34 per minute and who is becoming drowsy. Rationale: the drowsiness is the most important clue. The client may be developing hypercapnia, respiratory failure, carbon dioxide narcosis. Mental status changes signal deterioration. Nclex strategy. Never ignore neurologic changes in respiratory clients. Question 48. A nurse is caring for 4 clients during a mass casualty event. Resources are limited. Which client should receive treatment first? A. A client with an open femur fracture and palpable pulses. B. A client with severe respiratory distress whose airway can be rapidly opened with a simple maneuver. C. A client with extensive burns over 90% of the body. D. A client who is pulseless and apneic. Answer: B. A client with severe respiratory distress whose airway can be rapidly opened with a simple maneuver. Rationale: disaster triage prioritizes clients who have life-threatening conditions, are likely to survive with immediate intervention. The airway can be corrected quickly. The pulseless client is classified as expectant in many disaster scenarios when resources are overwhelmed. Nclex strategy. Disaster triage is different from normal triage. Think greatest good for the greatest number. Question 49. A nurse receives report on 4 clients. Which client should the nurse assess first? A. A client with syndrome of inappropriate antidiuretic hormone whose sodium level is 116 milliequivalent/L and who has new seizure activity. B. A client with hyperthyroidism reporting anxiety. C. A client with chronic kidney disease reporting fatigue. D. A client with pancreatitis requesting pain medication. Answer: A. A client with syndrome of inappropriate antidiuretic hormone whose sodium level is 116 milliequivalent/L and who has new seizure activity. Rationale: the client has severe symptomatic hyponatremia. Active seizure activity indicates immediate neurologic instability. This is a life-threatening emergency. Nclex strategy. Active seizure risk for seizure. Current instability beats potential instability. Question 50. A nurse receives report on 4 clients during shift change. Which client should be assessed first? A client with pulmonary embolism receiving heparin who suddenly develops hemoptysis and oxygen saturation of 84%. B. A client with septic shock whose urine output decreased to 10 milliliters per hour. C. A client with liver failure who develops confusion. D. A client with acute kidney injury whose potassium level is 5.8 milliequivalent/L. Answer: A. A client with pulmonary embolism receiving heparin who suddenly develops hemoptysis and oxygen saturation of 84%. Rationale. This question combines two life-threatening findings. Significant oxygenation failure. Possible worsening pulmonary embolism or pulmonary hemorrhage. The oxygen saturation of 84% indicates severe hypoxemia occurring right now. Although the septic shock client is critically ill, immediate oxygenation failure takes priority. Nclex strategy. The final Nclex rule. When torn between two critically ill clients, ask: who is losing oxygen to the brain at this moment? That client is usually the priority. Thank you for watching. If you found this video helpful, please like, subscribe, and turn on notifications so you never miss our latest Nclex content. Also, share this video with a fellow nursing student on the journey to becoming a registered nurse. Your support helps this channel continue creating high-quality Nclex reviews for future nurses everywhere.